Good afternoon, members of the media, wider viewing and listening public of Trinidad and Tobago. Welcome to the Ministry of National Security, and thank you all very much for coming at such short notice to a media conference where I have my two colleagues, the Minister of Health, Minister Deyalsingh, and the Minister of Social Development and Family Services, Minister Crichlow-Cockburn. Sorry. It's been a long day. Good afternoon. Members of the media, we've asked you all here today from a governmental perspective to address what started at around 2 a.m. this morning from our perspective. And this is with respect to the Transformed Life Ministry Rehabilitation Center. At about 2:30 a.m. this morning, as the Minister of National Security, I was contacted by the Commissioner of Police, Captain Gary Griffith, and he immediately briefed me on an ongoing operation that was taking place in Arouca on the Eastern Main Road with respect to this rehabilitation center. He provided me with certain information, told me that he had been in contact with my colleague, the Minister of Health, and we had further conversations as to how the operation should continue. At that stage, I immediately got onto my colleague, the Minister of Health, called me shortly thereafter, and we too had a conversation that was really directed at ensuring that we would have sufficient medical personnel and medical facilities for persons who had been found at this rehabilitation center. In essence, the briefing was that a raid was made at a specific center. Persons were found in what can only be described as questionable and inhumane conditions and were being held. It is unable to be determined, some against their will, some incoherent. And basically what we wanted to do is ensure at that time that the welfare of these people was taken care of. Of course, it was an ongoing police investigation that had commenced, but an ongoing police operation at that stage. When you go into these types of situations, you're really walking in not knowing what you're going to face. The Commissioner of Police expressed to me his concern at what he was seeing and said that the police will continue conducting their operation. The Minister of Health assured and asked what sort of numbers we were looking at of persons who we were at the time describing as victims, and what sort of assistance could be given from a medical perspective, and we are determined that the closest institution that would be able to accommodate, at the time we thought we were looking at about 75 persons, turned out to be 69, that they can be accommodated at the Mount Hope Medical Center. Fortunately, we got medical personnel there to begin examining people during the course of the next couple hours. The Commissioner of Police and myself stayed in touch over the period of the next couple hours, with him continuing to update me and brief me. I had sent a briefing on to the chairman of the National Security Council, just letting him know from a national security perspective that the police had conducted a raid and they had come upon certain circumstances that seemed to be very unsatisfactory. So from a national security perspective, what had happened is the Trinidad and Tobago Police Service, based on a tip-off, had led an operation into an institution, this specific rehabilitation center, had found, as we now know, 69 persons, male and female, being held in conditions that were, at minimum, inhumane, arguably degrading, and very questionable circumstances. By 8 o'clock this morning, as the Minister of National Security, I issued a statement with certain cautions. First caution being that when you go into these types of situations, you're really in a fact-gathering mind frame and mindset, and you're faced with things coming at you, and it was too early to make any declarations. Secondly, to caution persons that there is an ongoing police investigation, and it would be very imprudent for me to say anything further at that stage. Before that, I'd had conversations with my colleague, the Minister of Social Development and Family Services, to find out from a government perspective what our involvement was, if any, and in particular whether this institution, this rehabilitation center, was receiving any subventions from my colleague's ministry. The Minister of Health and myself continued to have conversations as he was in his ministry at that stage, gathering whatever information he could from the Ministry of Health perspective. This is a private institution. It is a registered, what we call an NGO, and registered in law as an NPO, a non-profit organization. The first that I heard of this center from a national security perspective or at all was this morning when I was contacted by the Commissioner of Police. During the time shortly after I was contacted by the Commissioner of Police, between 2:30 a.m. and 3 a.m., I was in contact with the Director of Counter-Trafficking Unit from the Ministry of National Security to find out what, if anything, we could provide, what any resources we would need to provide, just to make sure that she was aware. She too had been contacted by Trinidad and Tobago Police Service. The Trinidad and Tobago Police Service, there are certain officers who are assigned to the counter-trafficking unit, and they work in tandem. At this stage, I'd like to pass it over to my colleague, the Minister of Social Development and Family Services, to tell you all what we have found out and what, from a government perspective, from her ministry. Thank you very much.
Good afternoon, ladies and gentlemen. The Ministry of Social Development and Family Services had a relationship with Transform Life Ministries during the period 2010 to 2015. As an NGO, they would have applied to the ministry for subventions, and the service they provided was in terms of accommodating the socially displaced, our street dwellers, the homeless. So that is the service they would have provided during that period. During the period, however, the ministry became increasingly concerned with a number of issues. One had to do with the conditions under which these clients were being held. We also had concerns with the fact that they were submitting unsubstantiated invoices. We also looked at the issue of staffing. They didn't have the numbers required, nor did the staff there possess all of the skills that were required to take care particularly of mentally ill persons. And generally, the living conditions were poor. So over a period of time, a decision was taken to sever ties with Transform Life Ministry, and that would have been done during the period April to July 2015. We had 36 clients there in 2015, and they were all removed to our New Horizon facility by July 2015. So the last interaction the ministry would have had directly with Transform Life Ministries would have been in July 2015, when the last payment of the subvention was made to Transform Life Ministries.
So members of the media, wider listening and viewing public of Trinidad and Tobago, just to make the very clear point, from July 2015 to now, the government has paid no subvention to this particular rehabilitation center. And as you've heard the minister say, all ties between the Ministry of Social Development and Family Services, which is the ministry, as you know, is charged with providing social welfare and that social net for our citizens, had severed all ties. So under this administration, there has been no official relationship or otherwise no payment of any subvention between the respective ministry and the Transform Life Ministry Rehabilitation Center. At this stage, I'll ask the Minister of Health to address us from the Ministry of Health perspective. Thank you.
Thank you, and good afternoon to all. So, like the Minister of National Security, I became aware of this situation for the first time at 2:30 this morning, when the Commissioner of Police, Captain Gary Griffith, called me to say he had an exercise ongoing and he may need some backup medical personnel. I contacted the CEO of the North Central RHA, Mr. Davlin Thomas, to provide the necessary medical support. How did this situation unfold as far as the Ministry of Health is concerned? The Division of Aging, under my esteemed colleague here, would have received a report. That report was sent to the Chief Medical Officer on or around June 14th. The Chief Medical Officer then instructed the County Medical Officer of Health to visit the site. A site visit was actually made on June the 21st. That site visit, Accompanying the CMOH, County Medical Officer of Health, was the Division of Aging and a team of police officers from the Arouca police station. In the opinion of the County Medical Officer of Health and the Division of Aging, it was determined that what was happening there was more of a psychiatric nature and the mental health unit needed to get involved. The mental health unit of the Ministry of Health was apparently contacted and a site visit conducted on July 1st. So that is when the ministry got more intimately involved. A team of 3 people from the Ministry of Health and the Northwest RHA conducted the site visit on July 1st, 2019. The findings were as follows. It was a 2-story building with a chapel upstairs and a ground floor subdivided into open dorms. Several caged isolation rooms were designed as seclusion rooms to temporarily house clients if and when they became violent. At the time of the visit, on July 1st, 2019, they observed 1 client in an isolation room. All other clients were in common gathering areas and none were restrained. However, they did note that ventilation and lighting were poor and emergency preparation and equipment were deficient. Administratively, they found the institution to have poor policies regarding administration and record keeping, and inadequate recording of patient care. On the issue of their staffing, they noted that staffing was inadequate for the number of clients. There were 8-hour shifts with 5 persons per shift. The highest level of medical professional staff was the ENA. No other staff of a psychiatric training were there. The mental health unit then decided to issue a set of recommendations to the facility to bring them in line with requirements of the Mental Health Act to become an approved home. Under Section 28 of the Act, the minister may, subject to provisions of this part, issue a certificate approving the use of any house as an approved home for the reception of persons who are mentally ill, etc., etc. So they were in the process of bringing the home up to meet the requirements to classify as a home, as an approved home under Section 28(1) to 3 of the Mental Health Act. What were the summary of recommendations made? 1, TLM to immediately cease the admission of any new clients. 2, overcrowding needed to be urgently addressed by decanting some of the clientele. 3, urgent training is required for all staff and appropriately trained staff to be retained. My information is the institution put out an ad 2 weeks ago for psychiatric nurses. So they were apparently in the process of meeting some of the recommendations. 4, policies regarding security measures, risk assessments, fire prevention, and emergency preparedness measures needed to put in place if TLM wishes to apply. Ventilation and lighting need to be improved and brought in line with the approved homes for people with mental health problems guidelines. And record keeping and patient care documentation require urgent upgrading. So the home was in the process, my information as I got it this morning, of adhering to these recommendations from the Mental Health Division of the Ministry of Health. The question is, which I know you will ask, so let me give it to you. What are these patients currently doing? Where are they? 2 have gone back with their families. I could confirm that. One is being treated at Eric Williams Medical Sciences Complex for a non-psychiatric condition, not a psychiatric condition, a non-psychiatric condition. And the rest are being have been sent to St. Anne's, where they're being assessed and future determination will be made as to where these patients will be housed. And that is the information I have as it stands right now.
Thank you very much, colleagues. Members of the public, members of the media, today at around 2 a.m., 2:30 a.m. is when we first became aware of this very disturbing situation. We are still in the process of gathering information. There is a very active, ongoing police investigation. I was just meeting with the Commissioner of Police before coming here. This is in the police's hands. From the Ministry of National Security, we will continue to monitor the ongoing situation. There have been swirling around a lot of allegations. I can't say whether they're substantiated or unsubstantiated. What I can say is from the government's perspective, some of what we've seen and some of what we've been told has us very, very concerned. The people who we are most concerned about immediately are those who are found being held, housed at this rehabilitation center. And that is our first area of interest in ensuring that they're properly looked after and their welfare looked after. As you've heard the Minister of Health say, they're currently going through the evaluations that are necessary for an assessment to be done with respect to their psychiatric state. It appears as though the persons who are at this rehabilitation center, the 69 persons, may fall into the category of persons with certain mental health issues. We are pleading with the families who have family members there and who are being housed at this institution to get in contact with the Trinidad and Tobago Police Service and to make that contact so we can determine whose family members are available to assist in identification and other areas, for example, what happens next. The government wants to make it very clear that this rehabilitation center, the information we have at this stage from the Ministry of Health, was not registered and was not an approved center to house persons under the Mental Health Act. The Trinidad and Tobago Police Service, the men and women who again in the normal course of their duties put their lives at risk today and perform the duties that they did in the early hours of the morning under the supervision and the direction and the authority of the Commissioner of Police. Once again, we commend you. I commend them as the Minister of National Security for continuing to do what they are doing on a 24/7 basis to protect and serve. And this is just one of the many operations that we have ongoing. As I see, it is still very early. It is less than 24 hours since this broke and has been unfolding. As and when more information is available, we will provide it, or the Trinidad and Tobago Police Service will provide it. This matter has captured our attention. We have had significant conversation about it, but the conversation really at this stage is for us to gather the facts, to secure the files surrounding the matter, and for us to really get to the truth of what is going on. At this stage, the government has absolutely no interest in protracting any old talk or any unsubstantiated allegations. We are concerned about the welfare of persons, and I can tell you this: if anyone has breached any of the laws in Trinidad and Tobago, and in particular any criminal laws of Trinidad and Tobago, the Commissioner of Police and the Trinidad and Tobago Police Service are going to do all that is within their power to ensure that those persons are prosecuted. That conversation has taken place. One of the first conversations that I had with the Commissioner of Police this morning when he briefed me was that the DPP had been informed and that we would be working very closely with the DPP's office to ensure that if any criminal laws have been breached or broken, those persons will be brought to justice. At this stage, that is all that we can say. It would not be prudent for us to get into any further details, and we anxiously await the outcome of the police investigation, and certainly Ministry of National Security, working along with my colleagues in the other ministries, will be reviewing this situation from a governmental perspective. we can take a few questions at this stage.
Minister Young, you said you were briefed by the Commissioner earlier this morning. Did he indicate reasons for saying that there was human trafficking involved?
At the end of the day, the Commissioner of Police, I'm sure he will speak for himself, but certainly in the conversation we're having this morning, I understood that we were going into, as I call it, unknown territory. So the police went in based on a tip of maltreatment of persons and questionable activities, and what he found were persons being held, as he described it, in caged situation and caged circumstances. So he and his officers would have made an assessment and talked about human trafficking at that stage. It is too early for us to determine whether there is or there has been any human trafficking, but that is certainly one line of investigation that the police are pursuing.
You said that there was investigation on tip. When was this tip given, this morning or 2 months ago? Because the Commissioner, as we heard this morning, he said it's a 2-month investigation. So what is exactly?
Well, those are questions then you'll have to address to the Commissioner of Police. You've heard from the government perspective what we've outlined. I can also tell you that at the human trafficking branch at the Ministry of National Security, the counter-trafficking unit did receive a report, I believe it was in August of this year, that there were, I wouldn't put it questionable, I can't remember the exact language that was recorded, but there were concerns with respect to this rehabilitation center. Immediately, that information was passed over to the Trinidad and Tobago Police Service. That's what I became aware of this morning.
A couple questions to the Minister of Social Development. You mentioned that the subvention would have been stopped in 2015 before this government came into office, but given that there were certain reports coming in concerning this center prior, which led to the subvention being cut, would there have been any kind of monitoring by the ministry concerning what went on at the center thereafter?
No, the ministry would not have continued to monitor thereafter because we would have severed ties with them. This is a private institution and we had no jurisdiction over them. As the minister would have indicated, when we got the call at the Older Persons Information Center regarding concerns about possible elder abuse, we would have made the necessary contact with the Ministry of Health and our inspectors would have gone in with them to investigate that report.
Let me just assist with that. It is not for the Ministry of Social Development. They are not the ones who are charged with the responsibility of dealing with institutions of this type unless they are part of the landscape or there's some sort of contractual relationship. That falls with the Ministry of Health and the Mental Health Division if they are aware of it. So, I mean, in these circumstances, very often it is because of a tip-off that we will then intervene, and you've heard outlined as soon as we became aware from the Ministry of Health perspective, what are the necessary interventions that were made there.
As a follow-up question, this is not the first time they say that an elderly home has, come into the public eye concerning treatment.
But it's not an elderly home. This is an institution or a center where we found that certain persons who may have had psychiatric patients and disabilities being held.
That is true. But given that we've seen other homes or areas where they're offering care or health care to elderly or people with mental disorders, and we've seen now on 2 occasions where the conditions there have not been up to standard, will there be a review of the guidelines or the policies to govern these institutions that at the moment seem to just pop up?
But I think you're mixing up a number of institutions. You're mixing up, it seems as though you're trying to tie 2 institutions into one. If it is an institution that is going to house persons with psychiatric illness, persons who fall under the Mental Health Act. We've just heard the Minister of Health tell us that under the Mental Health Act, there's a process for registration and approval. That is something completely separate from homes that may house elderly people. So which one is it you're asking us about? Because there is law providing for the registration and approval of of homes,
under the
approved
Mental Health
homes
Act.
under the Mental Health Act to house persons with psychiatric illness.
I'm guessing then what I'm asking, will there be
You're guessing as you asking. Tell us.
will there be a revamp then of how we inspect these institutions?
Okay, so maybe I could come in here. And you were right when you spoke about the issue of the homes for the aged. And when we got from my colleague here the list of, I think, 270 something odd homes, the Ministry of Health totally revamped the way it looked at these homes. What we intend to do now is use that same robust model to look at any institution that we become aware of that is housing psychiatric patients. So we are going to be very, very strict. We have done it already. So we have done it for the...
I also think it is important to let the public know that the Ministry of Social Development and Family Services, through its Division of Aging, every registered home for the elderly, we make visits to those homes. And based on whatever is found, reports are done. If there is need to refer it to the Ministry of Health under the Private Hospitals Act, we do that. We also identify recommendations that are required to bring them up to the level where they are to a satisfactory level, and that is done, and we continue to monitor them. So all of the homes for the elderly in Trinidad and Tobago are in fact monitored by the Division of Aging.
Minister Deyalsingh,
Yes, sir.
were the ministry aware that St. Anne's were referring patients to this center? Is there any factor at all to that?
No, so I asked that same question. That's why I was 10 minutes late. I asked that same question to the Chief Medical Officer. He has advised me that there were no referrals that he is aware of that people from St. Anne's were being referred there. That is what he has advised me.
So between June 1st and this morning, these extra patients, because you did mention several patients that were there prior June 1st have been facilitated at other centers.
No, I never said that, sir.
No, you're mixing it up with what the Minister of Social Development said. That when the Ministry of Social Development and Family Services severed ties with this institution in July 2015, 36 clients, 36 patients who were then being paid for by the Ministry of Social Development and Family Services were moved and put into other homes. That's in July 2015, not when we as an administration became aware of a complaint and began investigating it in June.
All right.
Okay.
Good morning to the panel. Ryan Hamilton Davis,
Afternoon.
Trinidad News. Good afternoon, sorry. Now, from my understanding, the government washed their hands of this institution since 2015. And since then, reports have been coming in about the situation. Is that clear?
Well, I don't think that is what was said at all.
Exactly.
The government severed ties and
Severed
terminated its contractual relationship via the Ministry of Social Development and Family Services in July 2015. Certainly, as we are aware, the first we became aware of any complaints or tips or complaints with respect to this institution was in June of this year. So it's not over a period of time. There was a flood of complaints, etc. So in June this year, a complaint was made
Via the Older Persons Information Center.
and then it
sent
went
to the
health.
Ministry of Health. And we went in on June the 14th, on June the 21st.
And then from a national security perspective, the police received a tip at a high level, and that is what the Commissioner of Police actioned.
Okay, so is it that this institute was an unregistered institute
Yes.
in factuality?
It would seem
All right.
so.
Now, as far as from the government perspective and for the general public, institutes like this may be all over the country that aren't registered, aren't regulated or anything like that. Can the government give any kind of advice to people in the public who have a need to take care of their families and their loved ones, but they need to...
You've preempted me. I was going to conclude this afternoon's press conference, so maybe you're giving me the opportunity to conclude. What I'd like to caution from a government perspective is this is a real eye-opener. And we're asking that persons who may be in these situations, because we understand that there are a lot of families in Trinidad and Tobago who may have family members who are suffering from some sort of psychiatric illness, who may not be able to care for them themselves, or through the provision of medicine and medical assistance, keep them at home and this type of thing. That if they have to put them into an institution, a home such as this, surely now we know one of the first questions to ask is, are you an approved home? Have you been registered under the Mental Health Act? Do your own due diligence. Make sure, ask to see the circumstances, ask to see the situation
And
patients are being
visit.
given. Go and
And
visit.
go and visit.
That's what I mean. You know, so when you go to visit, ask to walk around, ask to speak to persons who may be there. I mean, they may be psychiatric persons. But if it were me, I'd want to get in there. I'd want to see exactly what are the circumstances my family member or the person I'm looking to admit at this institution is going to be subject to. Also, continue having your ongoing visits and these types of things. If there is any concern, and I'll put this out there now, if there is any concern with any other type of center or institution like this throughout Trinidad and Tobago, please get in contact with us. You can notify the police service, you can notify the Ministry of Health, the Ministry of Social Services and Social Development and Family Services, the Ministry of National Security, and we will action it.
For Mr. Deyalsingh,
Sure.
as far, well, from what I understood as well, you guys saw the place, you saw that there were needs for it to be completed,
To be brought up to a
To be brought up to
certain
standard.
standard, yes.
right? But isn't that the ministry itself advised that the place be closed down until these things are put into place and they didn't comply with that, or is it?
So my information is, we made a list of recommendations which I called out to bring the place up to standard. My information is, as about an hour ago, is that they were in the process of doing that. For example, as I said, they actually put out an ad 2 weeks ago for psychiatric nurses. That was one of the recommendations, that the urgent training is required for all staff, and appropriately trained staff need to be retained. So they were in fact doing that part of it.
I can tell you from a national security perspective, one of the things we will be looking at now is the law with respect to seeing that, is it a mandatory requirement, for example, for these types of institutions to be approved under the Mental Health Act? If it isn't, we'll be discussing, should that be made mandatory? Should there be that obligation? And then also, as I've just asked, if there are other homes where there are concerns, let us know, and we will send in the necessary authorities to do inspections. All right? Okay. Last question. Thanks.
Minister Young, you spoke about breaking several laws. You know, several accusations were made this morning concerning human trafficking.
I didn't speak about that. You said that the Commissioner of
several
Police,
accusations
right.
were made this morning
Correct.
concerning human trafficking and virtual slavery. As the pastor indicated, any intention to go on to sue the state for any defamatory remarks that were being made this morning?
Okay, first of all, let me just clarify something. You are the one that drew to my attention and saying that the Commissioner of Police, when he gave an interview on the scene this morning, talked about human trafficking, slavery, etc. I explained what I understood the Commissioner of Police's circumstances to be, and I'm certain he will speak for himself and he would have had his own reason as to why he said. If the pastor wants to take action, that is up to the pastor. The pastor will have to receive his own legal advice. It's not for me to give him any legal advice. The state's position is a very carefully considered position. There's certainly no statement coming from the state along the lines that has just been suggested, nor are we yet in a position to clarify or to say whether there has been any instance of human trafficking. That is still a possibility. As I say, there's an ongoing police investigation, and we are going to await the outcome of that. I am not surprised that the pastor would want to say whatever it is he said. I haven't seen anything from the pastor. I haven't spoken from the pastor, heard from the pastor, or anything like that. That's completely within his purview and his prerogative. All right? Members of the media, thank you all very much as usual. We appreciate your accommodation.